The TILDA project is the Irish Longitudinal Study on Ageing, and it's a major research project which aims to get a picture of all the domains of older people's lives so that it will help with planning for Irish society and Irish policy in the future.
TILDA has a unique funding structure. Most other longitudinal studies are funded by government solely. We're funded by 3 partners. In the first instance, Irish Life have funded the study. They've donated a philanthropic gift for funding, and they were the first to come on board, and their funding enabled great leverage when we were approaching other potential funders. Atlantic Philanthropies have substantially funded the study also, and the government, particularly the Department of Health, or led by the Department of Health, are funding the remainder of the study.
Irish Life got involved with TILDA because at the time TILDA was launching, we were looking at developing a range of community programs for the group. TILDA was a particularly good fit for us because Irish Life is the largest pensions provider in Ireland apart from the government, and the ageing study would give us useful information that we could actually use in our business. And the information would be available generally to everybody, but for us the information was of particular value.
Well, we want to get a representative group of people, and we want to inquire about all the domains of their lives. So we ask about their health, about their living standards, about their contact with friends and relatives.
TILDA is unique amongst longitudinal studies in a couple of ways. First of all, Ireland is one of the last countries to come on board with a longitudinal study. Virtually all other Western cultures are well on their way, on their second or third or indeed fourth wave of a longitudinal study. But the advantage of that is that we've been able to actually address questions which have been raised by other studies, and that's given us an advantage in this particular field. Furthermore, we've been able to develop assessments and use new technologies in TILDA which haven't been used before.
When all the information is available from TILDA in 10 years' time or whenever, it will be of great use to Irish Life because we have a large database of people who provide or who receive pensions from us, and we naturally are engaged with people who are ageing anyway, and that study will help us perhaps reshape or redesign products that might be of more use to our customers and to provide them a better service as they grow older.
It will have mapped out very accurately the status of people aged 50 and above in Ireland. We'll have a very good sense of people's expectations and how we can meet those expectations now, and hopefully in 10 years' time we'll have met those expectations. We'll be able to modify through policy changes our society so that it's a better place for people to live in and to experience growing old in. We will have informed particularly healthcare policy so that our health policy colleagues and our social policy colleagues can plan for the future. We at the moment don't know how many disabled people there are over the age of 50 in Ireland, so it's very difficult to plan disability services for that particular cohort at the moment. But in 10 years' time, we will have all of that information, and we'll have enacted, hopefully, on that information such that we've remodelled our health and social care services to meet the need and the emerging need because of predictions we've been able to do from our original data set.
The information that TILDA collects is important because our society is ageing. That means that we are having fewer children, and life expectancy is growing quite remarkably, so that we'll have larger numbers of older people in our society in the future. That's going to bring all sorts of challenges with it, and we need to be able to plan our services and facilities. We need to be able to understand how our society will change so that we can make Ireland the best place in the world to grow old.